HS 4.4. So as we've seen, there's different ways of categorizing the different types of jaundice. There's unconjugated versus conjugated, hyperbilirubinaemia, there's pre-hepatic, hepatic and extrahepatic causes. And you can also think about it like this. So unconjugated is hemolysis and Gilbert syndrome. Conjugated could either be due to cholestasis, which is slowing down of the bile, could be due to dilated ducts, due to gallstones or cholangiocarcinoma or pancreatic cancer, or it could be due to undilated ducts. That's more sort of the pancreatic cancer. Or it could be due to hepatocellular, so that's acute causes such as viral, alcohol, drugs, toxic, autoimmune, or chronic hepatitis such as chronic hepatitis and cirrhosis. So let's look at jaundice due to failure to metabolize bilirubin. So these are inherited disorders of bilirubin metabolism. There's two that you need to know about: Gilbert syndrome and Criggler-Najer, which is less important. So Gilbert syndrome, one thing important is that it's a benign inherited condition, so it's not necessarily bad, and quite a lot of people have it, 10% of Caucasians. And as I said, it's decreased in a mutation in the UDP glucuronide transferase, which conjugates the bilirubin into conjugated bilirubin. Another thing very important is that if you have unconjugated hyperbilirubinemia, you need to look for an increase in fasting bilirubin. So what happens is that if you're fasting and you're stressed, then that down regulates the bilirubin activity, so you can't conjugate it, meaning you're more likely to have hyperbilirubinemia. The liver itself could also be injured, causing jaundice. This could be due to failure of the cellular mechanisms of excretion, so that would be raised AST and ALT. Could be acute hepatitis, as I mentioned, due to viral, alcohol, drugs, toxins, or chronic hepatitis and cirrhosis. So let's have a look at hepatitis. So what is hepatitis? Well, essentially, viruses A, E, B, and C, they infect the hepatocytes, and the body's abnormal immune response, it kills the infected hepatocytes, causing hepatitis. And because there's a liver problem, you're going to get an AST/ALT increase. And as I mentioned, there's different kinds of hepatitis. There's A, E, which are very similar. There's B, and there's C. So first of all, let's looking at A. Well, actually, let's just compare them all in one go. Well, basically, hepatitis A to E, you can think about them in terms of transmission, severity, chronicity, treatment, and jaundice. Hepatitis A it's transmitted by fecal oral, and it's got a high incidence in the third world. It's a big epidemic, and the features of it's prodromal like symptoms. So prodrome means early symptoms, so very few flu-like illness, headache, nausea, and it causes jaundice because the conjugated bilirubin goes into the sinusoidal blood, which is then excreted into urine. So if we look at transmission of A and E, it's feces. Severity, it's mild to severe. Chronic, it's not chronic, so it's an acute cause of jaundice. Treatment, just use a vaccine, and jaundice, it does cause jaundice. Hepatitis E, it's got high incidence in the Indian subcontinent, and it's clinically very similar to hepatitis A. So now if we compare that to hepatitis B, well, hepatitis B is the leading cause of worldwide hepatitis and cirrhosis, and it's highly prevalent in China, sub-Saharan Africa, and the Indian subcontinent, with a low prevalence in the UK. It's transmitted from mainly sexual and IV drug use in the UK and Western world, as well as from infected blood, and the prevention and treatment is vaccination, and you treat selected patients using antiviral therapy. So if we look at transmission, well, it's sex. Severity is, again, it's acute hepatitis, mild to severe. It's 30% chronic, and treatment, again, is a vaccine. It might cause jaundice, right? So finally, looking at hepatitis C, epidemiology, it's mainly IV drug users that it affects, and healthcare workers due to needle stick injuries. It's transmitted from infected blood and IV drug use. Sexual transmission is very rare, unlike B. It's acute, it's very mild, so it's usually subclinical, so it's not even noticeable, and you usually recover 90% recovery, and liver failure is only in 1%. So if we look at transmission is basically poo, sex, and blood of A and E, B and C, feces, sex, and blood. Severity goes from acute to severity decreases, chronicity increases, and vaccine goes from yes vaccine to no vaccine needed, and goes from jaundice to no jaundice, right? So having looked at jaundice due to a failure in bile in the liver, or pre-hepatic hemolysis and Gilbert's, jaundice could also be due to a failure in bile flow, which could be intrahepatic, such as cancer, liver cancer, or liver destruction, whether it be autoimmune or due to drugs and chemicals like alcohol or toxic insult. It could be due to pure cholestasis, which is as a result of pregnancy and illness. It could also be drug-induced, so this is NSAIDs, non-steroidal anti-inflammatory drugs, which inhibit prostaglandins, remember, and antibiotics such as paracetamol, or even hormones. The jaundice, the failure in bile flow could also be due to the coming from outside the liver, so what comes after the liver? Well, it's the gallbladder, isn't it? Gallbladder and the common bile duct, so it could be due to gallstones blocking it, it could be due to bile duct disease, whether it be inflammation or cancer of the bile duct, cholangiocarcinoma, or compression from outside the bile duct, which could be due to lymph or pancreatic cancer. One important thing to note is that if the jaundice is due to drugs, so if the patient is taking paracetamol, is taking the antibiotics, and they have jaundice, then the ultrasound will be normal, the liver biopsy will be a brown stain, and the jaundice will resolve after stopping the drug. So taking a closer look at the gallstones. Gallstones, if you remember, they're normally due to cholesterol, sort of like crystal cholesterol, bulls. 80% or more cholesterol in the bile acids will lead to gallstones. There's different types of gallstones, however. It's usually cholesterol, but it could sometimes be pigment stones. Incidence, it happens more in women than men, and symptoms, it's got minor and major symptoms, the minor being nausea, dyspepsia. Dyspepsia is like nausea, illness, fat intolerance, because remember the bile acid is for fat absorption, so fat intolerance. But it's also got major symptoms. So if the jaundice is the gallstone is very serious, and it'll be jaundice because the bilirubin will, the bile acids will build back up into the liver and enter the blood. It would also lead to biliary colic pain, which is very serious. Big colic means it comes and goes, ascending infection up to the liver. So that's one of the causes of extrahepatic cholestasis. It could also be due to pancreatic cancer. So let's have a look at pancreatic cancer. Well, pancreatic cancer causes painless jaundice, which is very important because cancer of the head of the pancreas obstructs the bottom of the common bile duct, leading to painless jaundice, and weight loss is the red flag. So if they've got jaundice and they've also got weight loss, it's a bit of a red flag that it might be pancreatic cancer, and it's a very poor outcome